You just heard Vice President Mike Pence tell us that every state has the ability to conduct coronavirus tests, but reports say the test shortage is still a major obstacle to containing the virus. Our Dr. David Agus joins us from Los Angeles once again. Doctor, good morning. You heard what the Vice President had to say. What's your response?
A couple of things. One is having the ability to do tests and actually having, doing the tests and having the administrative ability to actually get people there, test them, give them results are separate things. The shocking thing to me is that overnight he could say no travel from Europe and it's going to stop as of midnight tonight. Yet he still can't get the 50 states in the United States to give him the data on what testing has happened and what are the results of those tests. That just didn't seem right to me.
Well, Dr. Agus, we know now the NBA has canceled its season, or suspended the rest of its season. Number of cities have canceled events. I know that you have helped to make some of those decisions. What goes into them?
They're critical decisions, and obviously it makes a lot of people unhappy because these are events that people have looked forward to for a long period of time. But you have to look at the infrastructure, medical in the city. If there are more illnesses, can it handle it? Are the hospitals full? Are the emergency rooms full? What is the demographic of the city and how many numbers of cases are there? And what we're seeing now is that it's just going more and more across the board. For a while, it was the centers of high numbers of cases. It was Seattle, it was the San Francisco area, it was New York, and now we're seeing more and more literally across the country because we have to stop spread of this virus. Public health methods work.
David, is that what you mean when you say you want to flatten the curve of the rate of spreading of the virus?
Exactly, Anthony, is that, if the virus happens all at once, and there's a big peak there, what's going to happen is our medical infrastructure is overwhelmed and many deaths will happen that don't need to happen. If we can slow the onset of the virus, we can actually handle it with the medical infrastructure in the United States, and the drugs that are in development now will hopefully happen.
All right, clear, concise messaging. Dr. David Agus, thank you. We'll be right back.